On today's episode of The Cord, we're diving into the science behind the equine umbilical cord tissue allograft. Equicenta CTM, not the marketing, not the hype, but the peer reviewed data, the clinical insights, and what it truly means for the future of musculoskeletal care in horses. I am honored to introduce our guest, Alicia Bertone, DVM, PhD, DACVS, DACVS-MR, a lifelong horsewoman, internationally respected equine surgeon, clinical scientist, a former faculty member at The Ohio State University's Galbraith Equine Center. Dr. Bertone has spent decades advancing orthopedic research, leading stem cell and molecular therapeutic studies, publishing extensively, mentoring the next generation of equine surgeons, and serving the highest level of sport horse medicine, including the World Equestrian Championships. In this episode, she walks through the research, the rigor, and what the data is actually showing. Take a listen.
Thank you very much to EPL for inviting me. I serve as a research consultant for EPL, and I'm happy to present our first publication and work that we've done. For starters, this is a review of really 5 studies rolled into one of cryopreserved equine umbilical cord tissue allograft, its characterization and biocompatibility in vivo and musculoskeletal tissues, and it is a fully controlled study. And it's important, this was published in BMC, which is Biomedical Central Medicine. It's a very high impact journal, so this has really been scrutinized by clinicians and scientists, and the conclusions made are reflected by the data in this study. These authors that are here are all independent contractors, as I am as an independent consultant, and so we had nothing to gain by the outcome of the results. That's our declaration. So everyone here knows the challenges of healing musculoskeletal problems in horses, particularly performance horses, where the expectation bar is high. The bar is that we want these horses to come back and actually perform fully again, and in as short order as possible. So very, very difficult, tall ask. Additionally, the traditional therapies have lacked all arms of anabolic, anti-catabolic, and anti-inflammatory proteins in a multi-pronged approach that is meant to be designed to be targeted specifically to the site. Umbilical allografts are processed to optimize the natural components of the umbilical tissue function to cushion and protect the umbilical vessels. The tissue is analogous to Wharton's jelly in human. Equine Performance Labs and Couteau Grove Farms are an exclusive partnership. And don't underestimate this. It's very important. It's one source, all under one umbrella of those trying to produce together as a team a quality product. Couteau Grove Farms is founded by Keith and Ginger Myers that are nationally and locally known in the racing industry. Both EPL and the Myers are committed to a passion for excellence in horses. The mission statement for EPL is grounded in science, transparency, and measurable results to deliver reliable state-of-the-art products. And this includes including controls in your work. And I'm sure you've seen that most do not, because it's not easy to do. The donors, just to point them out, they're adorable, vigorous, thoroughbred foals from this farm. Obviously, the mares and the foals have to meet extensive inclusion criteria in order to be donors. It is fetal tissue. Umbilical tissue comes from the foals. And so very important. Additionally, they are thoroughbred champions. Both these mares are stake winners. The sires are top stallions from Kentucky. And you might say, well, does that matter? Well, not all of us can be NFL champions and elite athletes, right? And the connective tissue, the strength of it, the tensile strength, the compliance, the healing, the flexibility, the repair, adaptability, all of that is very critical to be able to perform at that level. And so, as Dr. Gobble used to say, champions have good protoplasm. So in this paper, I will be summarizing why umbilical cord allograft represents a next generation product. And first, it is a fresh and native cryopreserved equine umbilical cord tissue allograft that has not been manipulated. The native tissues are as they were, except processed to become a microparticle. They are highly characterized, I'll show you that, within and among donors through proteomic and cytokine multiplex assays. We also have 3 controlled studies to present to you today in normal and diseased joints and ligaments, including microscopic evaluation of injected tissues and lymph nodes. The contribution to the field already was recognized by this journal, and that is that bioscaffolds in general are designated to provide structural support networks to damaged tissue and can improve the microenvironment of the site you're injecting, as well as fill defects or voids like in tendon and ligament. As such, the umbilical cord allograft may serve as a fetal protein dense structural foundation for the animal's endogenous cells to grow in on there and, of course, be exposed to those fetal proteins that are highly anabolic. So the research significance is that there's the few papers that are like this that use this level of controls, and they help fill the limited knowledge gaps that are in there for all allografts, and of course, very importantly, also for umbilical allografts. And this is amid a rising increase in the number of these that are sold, both in the human as well as in the animal space, much of it without data that supports either the characterization or that the products are actually improving over either Mother Nature or other treatments and therapies. Also, it's a model for human and animal. It's a one medicine approach. It's a clinical and histological outcomes of these multiple injections in these multiple models can be evaluated to assess therapeutic potential in both human and animal. The proteomic study was a high resolution tandem mass spectrometry that was used for protein identification and quantification based on total spectral counts. Proteins are fully annotated individually by using an Equus proteome and UniProbe database. The consistency among donors is measured statistically to look both within donors, within batch, as well as between donors, and all donors were evaluated for this. Also, the cytokine quantification was done by ELISA, which is a different analysis that looks for functionality. And the multiplex ELISA quantified the inflammatory and anti-inflammatory cytokines to evaluate immunomodulatory effects of the allograft. In vivo, there were 3 studies rolled into one. The first one is a prospective randomized controlled study, blinded, where the umbilical injection were administered to carpal joints and suspensory ligaments in clinically normal horses to evaluate biocompatibility over 42 days compared to a saline administration. For the prospective controlled pilot study, horses with osteoarthritis and desmitis tendinitis were monitored for improvements in lameness and pain over 28 days of the injection compared to their 28 days before the injection under all the same control environment. So they had a baseline control. Post-injection examination of multiple joint and ligament injections and tissues were done in a multi-dosing pathology study. In this case, we focused more closely on the early time point. So at day -2 and -5, these horses were evaluated over this time point, both by physical exam, et cetera, as well as synovial fluid analysis. And then at harvest of the tissues of synovium, cartilage, ligament that had been injected, as well as the control limbs, which were normal, had not been injected. And then that of the lymph nodes were included in that. And that's very important with any kind of product that you also look at the reaction to that product, particularly one that is either foreign or one that might be allogeneic or xenogenic, is to look for that. So the results of the study showed that the proteomics revealed 2,645 annotated and unique proteins. So there's a lot in there. The abundant proteins and all the moderately abundant proteins, we're talking hundreds of proteins. And if you care, in the manuscript, you can go to the supplementary tables and get more information on that. And this is confirmed. And additionally, it was present in all donors. So it wasn't until you get to the really rare ones that some of them fell out. Inflammatory cytokines were low. We'll talk about this more. The anabolic, anti-catabolic, and anti-inflammatory proteins are present, and it's biocompatible and safe for joints and ligaments. So let's look a little closer, just as an example here today, of some of these proteins. So obviously, collagens, fibrillar proteins are important, and you can see type 1 is there because that's the dominant collagen in all connective tissue. But these smaller and earlier repair collagens are there, and they're very critical as a backbone of connective tissue for tensile strength, et cetera, in all musculoskeletal tissue. And it helps with biomechanical integrity and the durability of any tissue. Proteoglycans, not only the aggregate of cartilage is there, but also the smaller proteoglycans like decarin, biglycan, lumican, and heparin sulfate. And these are very critical proteins in the interstitium that can contribute to the matrix organization, the resilience and interaction with collagen, as well as retaining water, a very important quality for looking at resistance to compressive forces. The glycosaminoglycans, and you know these already, chondroitin sulfate, keratin sulfate, and hyaluronic acid are there. They maintain an extracellular matrix hydration and compressive strength that is critical, particularly for cartilage health, joint lubrication, and cushioning against mechanical stress. Alpha 2 macroglobulin is there in abundance. And again, it's a broad spectrum protease inhibitor that can prevent enzymatic degradation of cartilage and soft tissue matrix. It modulates inflammation as well by binding to inflammatory cytokines. And then this is just one to note, the annexin lipocortin, that's Mother Nature's steroid. It modulates inflammation and immune response. It facilitates resolution of inflammation processes, and it supports a faster recovery without pathologic fibrosis. As you know, one of the uses of steroids is to resist the formation of fibrosis. Another key point is that when this product, the supermajority of it is this. It is all pro-reparative proteins, meaning anti-inflammatory, anabolic, and anti-catabolic proteins, both in the soluble portion or the supernatant, but also in the particulate allograft. And it is within the tissue particles as well. And you compare this to a blood product, well, besides being mostly water, when you look at the proteins, the albumin and globulin dominate. It's a majority of what's there, and there's no reparative function to that. So you're looking at the very small quantity of the proteins in a blood product, even though it might be diluted in a much larger volume. So in summary of the proteomics, these identified both fibrillar and glycan proteins that are essential for connective tissue functions. That both soluble proteins as well as the tissue scaffold contain anabolic, anti-catabolic, and anti-inflammatory proteins, resulting in a multimodal mechanism of action. The umbilical cord tissue stability and diverse protein profile suggest promise for musculoskeletal multinodal supportive therapy. Looking at the cytokine characterization by ELISA, you can see everything was looked at here. And I'll just point out the inflammatory ones, the interferon gamma, IL-1, IL-2, 4, 6, 8, 10, 15, MCP. These were all extremely low in the product, like as in below the level of detection or at the very low end of the standard curve. IL-8, IL-1RA, and VEGF, and IL-1RA is an interleukin-1 receptor antagonist that can block IL-1, and vascular endothelial growth factor were at levels that are found in normal equine synovial fluid. The key message here is that the product itself is not delivering cytokines. For the prospective study that was the safety study, we analyzed for lameness, pain, and circumference for swelling, as well as a lot of other things. One carpus was injected, randomly assigned, was injected with saline, the opposite with equicenta. The synovial fluids were analyzed for total nucleate cell count, total protein differential, as well as albumin and globulin, looking for an immune component, and all the multiplex cytokines, as well as some additional growth factors. This was done frequently, day 0, 1, 3, 5, 10, 21, and then out to 42 days, with half of the horses starting with the joint and then moving to the ligament, and half of the horses, so 8 horses total, moving from the ligament to the joint, with all horses receiving 2 injections over the time period. And synovial fluid and serum amyloid A, looking for any systemic reaction, was followed at a very tight and multiple time points. And when I did a literature search, there's no doubt that this is at least that I could find in the literature, this is the most detailed, in-depth study of a synovial fluid, meaning a joint reaction and or response, I should say, to an injection of a product. You'll see ones do day 0, you'll see them do it again at 2 weeks. Well, by then they've missed any inflammatory risk problem, or they'll do IL-1RA and no IL-1, and as we know, that ratio is really critical. So again, this is a very complete study. What we found was that on lameness and pain, all the horses had a median score of 0. That means that they didn't get lame, they weren't lame, and they aren't lame. For the circumference, it was uncannily similar. There was no measurable swelling apparent. And so overall, there was no systemic inflammation detected by the SAA. There was no immune reaction noted or detected on second injection, and there were no adverse reactions. So the outcome of the normal clinical safety study, which was a prospective blind and randomized clinical trial, the normal horses that were injected showed no lameness, pain, or swelling or adverse reactions over 42 days, which is also longer than most, indicating clinical safety. For the horses that were in the pilot study for diseased horses that had osteoarthritis or tendonitis desmitis, all horses had a reduction in lameness or pain by 1 grade. That was observed over the 28 days of the study. And this was comparing to the horses still being confined and walking, all the things that were being done to them in the last 28 days compared to that time point. So they served as their own control. And here's an example of a Tennessee walking horse that had, and this might be hard for you to appreciate, but there's a redness to the skin. This is right after injection. I wish I got just before, but I didn't. The whole area was red. There was a pitting edema still present here, and there was some heat that you could feel there that was injected. This is the ultrasound of that horse. You can see that right at the insertion of the distal check ligament onto the deep flexor, that both were involved in this injury, that it was sort of a chronic active injury. There was some evidence of chronicity, but this heterogeneity was then the targeted site of the injection intralesionally. This product, that is what it's designed for, is to go intralesionally where it can provide scaffold as well as release these proteins to help support the tissue itself to heal to a better, quicker level. This is 5 days later, and the redness was gone, the pitting edema was gone in this one case, I know. But you could start to see now where the old fibrotic lesion was. It started to really clear up what was the chronic and what was the potential active. So now moving on to the in vivo studies where we also looked at the synovial fluid, you can see that it was these joint fluids were also extremely low, below level of detection in the low end of the standard curve on all inflammatory cytokines, including IL-1. That there was an increase, a statistically significant increase in IL-1RA, IL-10, the good cytokine, and the ratio of IL-1RA to IL-1, indicating an anti-inflammatory profile. And when I say this, this is not a small increase. The increase was 400% on the ratio of IL-1RA to IL-1 from compared to these horses' baselines and compared to saline as well. Statistically greater than saline. As you know, saline does produce an inflammatory response to the joint, but this was significantly greater than that and obviously greater than baseline. And in the analysis of the synovial fluid, you can see that there was a subclinical synovitis. It was a transient neutrophilic synovitis, as is typical of anything that's been injected. If you go back and look at whether it's HA or you just go back and look at any of these studies, you're going to get this influx. We studied it again more frequently than anyone else and saw that the peak was at day 1, and then as it resolved by day 5 in all horses. And when we looked at our other study in where we looked at pathology, we studied that. And I'm going to report more on it because we wanted to know, were these neutrophils just chemotactically going from the blood to the synovial fluid, just moving on through to see what's in there, or were they residing in the synovial membrane? And that's a critical difference. So we look at that. Here it is. So here's the results. This just shows synovial membrane here on your left, showing villi. And the general impression is there's not hyperplasia here. There's not hypertrophy, meaning big, thick villi. None of that. And also, if you look up close in this insert, you see healthy synovial cells, 2 cell layers thick. You don't see perivascular cuffing. You don't see neutrophils filling this space. It's basically not inflamed. And the control group was the uninjected limb and then the injected limb that received up to 3 injections between the joints and the ligaments. The aggregans still staying very positive. There was no difference in the cartilage. And then in the lymph nodes, very importantly, you want to look at this subcapsular area. This is an active lymph node in both the control limbs as well as in the treated limbs. They had active lymph nodes, meaning normal. And then you want to look very closely at this subcapsular area. Very early on, you'll get edema that can form there. You can get lymphocytes accumulate. You can get type 2 macrophage phenotypic changes. You can even get worse. I mean, you could get giant cell reaction or a foreign body reaction or something that would be considered a negative, meaning above all, do no harm. We did not see any of that, and that's why an independent veterinary pathologist, blinded to everything, went through this 90 slides in depth and in detail of work. We did not see any evidence of particle there. We didn't see any evidence of reaction. And the implications of this are that the cryopreserved equine umbilical tissue allografts were safe and in a pilot study improved clinical measures after joint and ligament injections without adverse events. That the umbilical cord allograft equicenta has consistent and a robust protein profile with fibrillar, anabolic, anti-catabolic, and immunoregulatory properties that are useful for the management of osteoarthritis, desmitis, and tendonitis. And the results support a broader study and the use of umbilical allografts in veterinary and human regenerative medicine for musculoskeletal conditions. And I'd like to, before I move on, and say that these come to you at -80 freezer. And so they are kept frozen at -80. You can say, why -80? Well, because all enzymatic processes that would support degradation, based on the science, says that it's arrested at that temperature. Anything less than that, and these proteins could begin to slowly degrade. So when you put proteins in a refrigerator for a week, they're degraded. And it can still be in a refrigerator, but that's not ideal. without some other kind of something happening that you would be more of an active role in that product. So it's very important, and that's what you're guaranteed. When you thaw this out from a -80, but and when you thaw that out in your hand and you immediately 10 minutes later inject, you can be confident that you're delivering exactly what has been studied in all of these studies. Thank you for taking the time to understand the science behind equine umbilical cord tissue allograft, equicenta CTM. And thank you to Equine Performance Labs for having me. Together with science, EPL remains committed to advancing care with one simple philosophy: horse first, sport second. Thank you.
If this conversation sparked new thinking or gave you a deeper understanding of the science behind equine regenerative medicine, make sure to follow along the cord. Share the episode with a colleague or a fellow horse owner, and stay connected as we continue to bring you the experts, the evidence, and the stories shaping the future of equine care.